And while doctors and nurses are also dealing with an increase in COVID-19 patients, emergency room staff are also seeing an increase in people coming in for mental health issues. WRTV's Alyssa Donovan found out how this is impacting local healthcare systems.
In IU Health's large emergency departments, 1 in 4 people coming in are seeking behavioral health assistance, and doctors say resources are starting to run thin.
A lot of the inpatient units are reaching capacity.
The amount of people who need mental health care has greatly increased this year.
Compared to 2019, we are seeing about double the amount of patients coming into our emergency departments with a primary diagnosis of behavioral health.
IU Health is not the only healthcare system feeling the impact.
The clinics that we treat anxiety, depression, addiction, we've seen our biggest increase in access to care at those clinics.
Eskenazi Health Clinics have seen a 35% increase in people seeking mental health care in just the past 3 months. And the increase in patients is taking a toll on healthcare workers. Eskenazi is providing time for staff to talk with the supervisor.
To talk about tough cases, things that are going on for them, how they're kind of coping with all the changes that we have had to do in response to the pandemic.
IU Health is also providing support for workers. They're getting ready to start a peer support program as well as counseling.
We're trying to help each and every person that we can in the way they need help. I will tell you that it is difficult.
If you are experiencing depression, anxiety, or suicidal ideation, you can start with your primary care physician. And if you need to, you can walk into any emergency department for help or call a mental health hotline. I'm Alyssa Donovan, WRTV.
Eskenazi Health does have a mental health line. That number is 317-880-8491.